When I finally understood why sex had become impossible, why every intimate moment with my husband ended in searing pain and tears, I sat on my bathroom floor and screamed until my throat was raw. The gynecologist's words were still echoing in my head. You have significant scar tissue from what appears to be an extensive episiotomy, possibly 4th degree. Were you told about this procedure? Did you consent to surgical cutting? I hadn't. Nobody had asked me. Nobody had told me. But someone had taken a scalpel to my body anyway, and now, 18 months after my daughter's birth, I was living with damage so severe that 3 specialists had used the word repair surgery. The medical records I'd requested told a story completely different from the one I'd lived, and somewhere in that gap between truth and documentation was the answer to why my body no longer felt like mine, that I'd done everything right during my pregnancy. I read every book, took every class, interviewed 3 practices before choosing Dr. Morrison's group. I hired a doula and created a detailed birth plan that explicitly stated, minimal intervention, no episiotomy unless absolutely medically necessary, with my clear verbal consent. I laminated copies, one for my hospital bag, one for my doula, one for my husband to guard with his life. I wasn't naive. I was a high school teacher with a master's degree who researched everything obsessively. When I chose Mercy General Hospital, it was because their website boasted a 23% C-section rate and mother-centered care philosophy. I walked into that hospital believing I was prepared, protected, informed. I had no idea my carefully constructed plans were about to become worthless paper. My water broke at home while washing dishes, and I felt that surge of excitement mixed with terror. Contractions started gradually, 5 minutes apart, manageable. At Mercy General around 10 p.m., I was 4 centimeters dilated, and the admitting nurse smiled warmly. "First baby? You're going to do great, honey." Everything seemed perfect. But when the resident came in for intake, she barely glanced at my birth plan before setting it aside. "We'll do our best," she said, in a tone that made those words sound hollow. I felt anxiety flutter in my chest but pushed it down. Looking back now, I can see that dismissive gesture for what it was, the first warning that my voice was about to disappear. Labor progressed steadily through the night. I walked the halls, rocked on the birth ball, breathed through contractions that grew stronger. By 4 a.m., I was 7 centimeters dilated and feeling empowered. But then the shift changed, and Dr. Harrison walked in, not Dr. Morrison, whom I'd never met. Dr. Harrison was the on-call physician, a man in his late 50s who looked at me like a malfunctioning appliance. He checked the monitors, examined me with rough, painful fingers, and frowned. "You're taking too long," he announced, though I'd been laboring only 6 hours with steady progress. "We need to speed things up." Before I could respond, he ordered pitocin without asking, without explaining risks, without giving me any choice. When I tried to say I wanted to continue naturally, he was already walking out. "It's hospital protocol for prolonged labor," the nurse said, hooking up the 4. I looked at my doula, confused. 6 hours wasn't prolonged. But the pitocin was already dripping into my veins, and I didn't know I could refuse. The synthetic contractions hit like a freight train, waves of pain so intense I couldn't catch my breath between them. Within an hour, I was begging for an epidural, my natural birth plan forgotten in the face of unnaturally amplified agony. The anesthesiologist came quickly, and I felt grateful even as I felt defeated. But the epidural didn't take evenly. My left side went numb while my right side still felt everything, creating this bizarre half-existence where I could feel the pressure and pain but couldn't move to cope with it. I told the nurse something was wrong, that I could still feel too much, but she just adjusted my position and said, "That's normal, honey. "You're doing fine." I wasn't fine. I was trapped in my body, stuck in bed now, monitors strapped across my belly, unable to move, unable to escape the pain that kept building. My doula kept asking the nurses to check the epidural, but nobody seemed concerned. Hours blurred together in a haze of pain and exhaustion, and somewhere around 9 a.m., I heard Dr. Harrison say I was finally complete, 10 centimeters, ready to push. I felt a wave of relief. This nightmare was almost over. I had no idea it was just beginning. Pushing was brutal and exhausting, made worse by the fact that I was flat on my back despite my birth plan specifically requesting upright positions. Every time I tried to shift, someone pushed me back down. "Stay still," they kept saying. "You need to push more effectively." I pushed for an hour, then 2, feeling my daughter moving down, feeling progress happening even though Dr. Harrison kept saying I wasn't doing it right. My doula could see the baby's head, kept telling me I was so close, but Dr. Harrison was getting impatient, checking his watch, muttering about his schedule. At the 2-hour mark, he stood up abruptly and said, "We need to get this baby out now. I'm going to do an episiotomy." I felt ice flood my veins. "No," I said clearly, or as clearly as I could between contractions. "Please, can I keep trying? My birth plan says no episiotomy unless emergency." He didn't even look at me. "This is an emergency," he said, reaching for instruments I couldn't see. "Your baby's heart rate is fine, you're not bleeding, I just need you to wait," I tried to say, but another contraction hit and I was pushing, my body doing what it was designed to do. I felt the burning, stretching sensation, the ring of fire they tell you about, the sign that birth is imminent. My doula was saying she's crowning. She's right there. But I also felt something else, something sharp and cold and completely wrong. The pain was like nothing I can adequately describe, a burning, tearing agony that went beyond anything natural. I screamed, not the productive pushing scream but a scream of violation, of something being fundamentally wrong. "Stop. Something's wrong. What are you doing?" I could feel the scissors, feel the cutting, feel him slicing through my flesh while I was still conscious, still feeling everything because my epidural had failed on that side. Nobody stopped. Nobody paused. My husband was asking what was happening, my doula was protesting, and the nurse was holding my leg in position while I thrashed and screamed, "No, no, no, please stop." The cutting continued, deeper than it should have gone, further than was necessary, through muscle and tissue while I felt every millimeter. And then my daughter was born in the next push, sliding out into the world accompanied by my screams and blood, so much blood. I heard her cry, that first beautiful wail, but I couldn't focus on it because the pain in my body was consuming everything. I looked down and saw blood pooling beneath me, saw Dr. Harrison's face go pale, heard him say, "Get me more sutures, she's bleeding out." And then, through my shock and horror, I heard him say to the nurse in a voice not quite low enough, "The cut extended. 4th-degree tear." The next hour was a blur of stitching and pain. Dr. Harrison worked between my legs for what felt like an eternity, sewing me back together while I held my newborn daughter and tried not to vomit from the pain. The epidural still wasn't working properly on my right side, so I felt most of the repair work, every needle, every pull of thread through my traumatized flesh. When I moaned in pain, the nurse told me to focus on my baby, as if joy could override agony. Nobody apologized. Nobody explained what had happened. "You must have misheard," she smiled. "You were in a lot of pain and stress. Memory can be funny during birth. Going home should have been joyful, but I could barely walk. The pain was so severe I couldn't sit, couldn't stand for long, couldn't do anything but lie on my side crying while trying to care for my newborn. My husband did everything, all the diaper changes, bringing the baby for feeding, helping me to the bathroom where I sobbed every time I tried to urinate. "This is normal after birth," my mom kept saying. But something in my gut told me this wasn't normal. I couldn't sit without excruciating pain. I couldn't stand at the grocery checkout without feeling like my insides were falling out. At my 2-week checkup, I told Dr. Morrison, finally meeting her, that I was in unbearable pain. She examined me quickly and said, "You're healing fine. First babies are tough. Give it more time." When I mentioned my discharge papers didn't match what I'd heard during delivery, she frowned and said, "Dr. Harrison is an excellent physician. Your records show a second-degree tear, naturally occurring." But it didn't happen naturally, and I knew it, even if nobody would validate what I'd experienced. Months passed, and the pain didn't improve. It changed, evolved, became my constant companion. I couldn't run anymore, couldn't do yoga, couldn't pick up my daughter without feeling like I might collapse. Sex was impossible. The one time my husband and I tried at 3 months postpartum, I screamed in pain so severe he immediately stopped, horrified. I cried in his arms for hours that night, feeling broken and damaged and scared that this was my new permanent reality. My 6-week checkup had been fine according to Dr. Morrison. "You're healing well, you can resume normal activities," but my body told a completely different story. I saw 3 different doctors over the next year, each one examining me with increasingly concerned expressions. The third one, a pelvic floor specialist, was the first to tell me the truth. "This level of scarring is extensive. This is consistent with a 4th-degree episiotomy that extended into a severe tear. Were you informed this procedure was performed?" I sat there in my paper gown, 20 months after giving birth, finally hearing someone acknowledge that what happened to me was real, was documented in my very anatomy even if it wasn't documented honestly in my medical records. I started sobbing so hard I couldn't breathe. It wasn't healing that I needed, it was validation that I hadn't imagined my own violation. I requested my complete medical records, and it took 8 months and a lawyer's letter to finally receive them. When I opened the file, I found notes that contradicted each other, a delivery summary that mentioned extensive episiotomy performed buried in nursing notes, but a physician's report that said 2nd-degree spontaneous laceration. I found records showing I'd explicitly refused episiotomy in my birth plan, which was scanned into my chart. I found a note from my doula documenting that I'd verbally said no to the procedure. And I found absolutely no consent form for surgical cutting, no documentation of informed consent, no record of any medical emergency that would have justified overriding my refusal. What I found instead was evidence of a doctor who decided that his schedule mattered more than my bodily autonomy, who cut me without permission because he was impatient, and who then lied on official documents to cover up what he'd done. The extension he'd mentioned, the 4th-degree tear, wasn't a complication of natural tearing. It was a complication of his unauthorized cutting, his excessive force, his complete disregard for my right to refuse. Now I live every day with the consequences of his decision while he continues to practice medicine without any accountability. I'm pursuing legal action, though my lawyer warns me that medical malpractice cases involving birth are incredibly difficult to win. "You had a healthy baby," he explains, as if that erases what was done to my body. "I've had 2 reconstructive surgeries to repair the damage, and I'm looking at a 3rd. I still can't have pain-free intercourse with my husband. I can't run or jump without leaking urine. I have chronic pelvic pain that flares unpredictably, turning good days into nightmares without warning. I've spent over $30,000 on medical care trying to undo what one doctor did in seconds without my permission. My marriage has suffered under the weight of my trauma and physical limitations. I've been in therapy for 18 months trying to process the violation, the gaslighting, the betrayal of a system I trusted to protect me. But I'm also angrier and more determined than I've ever been in my life, because I've learned that what happened to me happens to thousands of women every year: unauthorized cutting, coerced procedures, documented lies, stolen consent. I speak at birth advocacy groups now, sharing my story with pregnant women and teaching them the phrases I wish I'd known. I do not consent to episiotomy under any circumstances. If you believe there is a genuine emergency, you must explain it to me and get my explicit verbal consent before cutting my body. I want video recording of my delivery. I want everything documented. I help other women request their medical records and connect them with lawyers who specialize in birth trauma. I've joined legislative advocacy groups pushing for mandatory informed consent protocols and real consequences for physicians who violate patient autonomy. I've learned that episiotomy rates should be below 15% according to medical evidence, but some doctors still perform them routinely because it's faster, more convenient, easier to control. I've learned that fourth-degree tears from episiotomy are a known complication, that cutting increases tear severity rather than preventing it, which is why the procedure should only be done in true emergencies with consent. I've learned that hospitals protect doctors by altering records, that women are routinely gaslit about their own birth experiences, that saying no in a delivery room often means nothing if you don't have advocates willing to physically stand between you and unauthorized procedures. My daughter is 2 now, beautiful and healthy and completely unaware that her birth was the most traumatic experience of my life. I love her with every fiber of my being, and I would endure it all again to have her here. But I shouldn't have had to endure it. No woman should have to trade her bodily autonomy for a healthy baby. We deserve both. I'm telling you this story because I need you to understand that medical violence during birth is real, is common, and is systematically covered up by the very institutions claiming to provide mother-centered care. I'm telling you this because the most dangerous thing I brought into that delivery room wasn't my birth plan or my expectations, it was my unquestioning trust in a system that views women's bodies as objects to be managed rather than people with rights. My voice, the one that said no, the one they ignored, the one they tried to silence with false records and gaslighting, is louder now than it's ever been. Because I know what they took from me that night, and I'm going to spend the rest of my life making sure every woman knows she has the right to refuse, the power to demand consent, and the voice to say this is my body, and you will not touch it without my explicit permission, and mean it.